Hi everybody, welcome back to my channel. If you're new, welcome to my channel. Today I am going to be doing another quiz. I recently did a mom IQ quiz, and today I'm going to be doing a medical terminology quiz. So I'm using the same site that I did for the mom quiz, and that one was very easy, so I'm not sure how this one is going to be, but we're going to find out right now. I will leave a link down below where you can find the quiz. So there's 49 questions. Hopefully we can get through all of them before my son wakes up. So let's get started. Number one is, what is hopefully I can pronounce this. What is osteoporosis? And it's bone loss, the pores in your skin, or a loss of hearing. So bone loss. Correct. What is the medical term for headache? Concussion, Cephalalgia, or migraine? So a migraine and a headache I feel like is different. Migraine is very severe. And a concussion you get when you like hit your head or something, and I don't know what Cephalalgia is, so I'm going to choose that. And that is correct, surprisingly. Question number 3. What do suffixes dynia and algia mean? D-Y-N-I-A and A-L-G-I-A. What do those mean? Deficiency, pain, or fixation? I'm going to choose fixation. That is incorrect. The correct answer is pain. What is a contusion? A muscle contraction, a head injury, or a bruise? I'm going to go with a bruise. Don't know if that's right, but we'll find out. Yes, that's correct. Question number 5. Which medical term describes the scraping away of the skin or mucous membrane by friction? So, carbuncle, abrasion, or contusion? I'm pretty sure it's abrasion. Yep. Which medical term describes accumulation of blood in a joint? Hepatitis, haematocrit, or hemarthrosis? I'm going to go with hemarthrosis. That's correct. What do the prefixes cardia and cardio refer to? Lungs, heart, or cartilage? So a cardiologist is somebody who's a doctor for your heart. So, yep. Which medical term describes the protrusion of the eyeballs? Ophthalmalis. Sorry, I know I'm probably not pronouncing these words correct. Anyway. Apophyseation or exophthalmalis? I'm going to go with the first answer, which is incorrect. Apparently it's exophthalmalis or whatever that is. Apparently this is not as easy as the mom quiz. Maybe I just been a mom long enough that the mom quiz was easy, but this is not as easy as I expected. And I watch a lot of Grey's Anatomy. I've watched from season 1 all the way up to current multiple times, so I thought this might have been kind of easy, but apparently not. Anyway, question number 9. Which medical term describes blood in the urine? Haematocrit, hematuria, or uremia. I'm going to go with Haematocrit because hema, I'm pretty sure, means blood, and urea, I guess, would stand for like urine. So that is correct. See, Grey's Anatomy does pay off. Or high school biology. Anyway, either one. Which medical term describes an agent that causes disease? Protease, pathogen, or prophylaxis? I'm going to go with a pathogen, and that is correct. Number 11. Which medical term describes a woman who has never been pregnant? Okay, I didn't realize that there was a term for this, so this is just going to be a guess. The options are nulla gravidia, primipara, or primigravidia. I'm going to go with null gravidia because null obviously means no, and that is correct. Number 12. Which medical term describes the bluish discoloration of the skin? Cilium, edema, or cyanosis? Cyanosis is correct. Question number 13. The word emesis means vomiting, eating, or heartburn. I'm going to go with vomiting. That is correct. Question number 14. Which medical term describes the infection of the fungus Candida? Either titter, thrush, or macrophage. I'm just going to guess thrush because that's the only one that I've heard of, and that is correct. Question number 15. Which medical term describes the red blood cell? Leukocyte, lymphocyte, or erythrocyte? Okay, so I should know this because I remember learning about this in biology. I'm pretty sure a leukocyte is white blood cells, so I'm going to go with erythrocyte. Yay! Ha ha ha! Okay, number 16 is to aspirate means heart rhythm, inhale food or objects into the lung, and to have a painful feeling in the chest region. Okay, aspirate means like when you take something and like if you choke or I don't know, something. So that is correct. Okay, number 17 is which medical term describes the surgical transplant of the cornea? Keratoscopy, corneoplasty, or a keratoplasty. So I'm going to guess it's a corneoplasty because cornea, you know. Okay, so apparently I'm not that smart. Apparently it's a keratoplasty. Anyway, what do the prefixes homeo and hemia mean? Liver, blood, or bone. So I am going to go with blood. Correct. Question number 19. To be ambulatory is to be ambiguous, able to walk, a patient not confined to a bed, or to be able to understand and verbalize. So I'm not exactly sure. I know like in hospitals I've seen signs about like being ambulatory and stuff. So it's either being able to walk, not confined to a bed, or being able to understand and verbalize. I'm going to choose being able to walk. Correct. Number 20. What does syncope mean? An instrument to look in your ears, a sinus infection, or fainting. I'm going to go with instrument to look in your ears. Okay, no, that's wrong. It is fainting. Question number 21. What does febrile mean? A female child, a foot condition, or fever? I'm going to go with fever. That is correct. Which medical term describes the abnormal widening of the bronchi? Asthma, bronchitis, or bronchiectasis? I'm pretty sure asthma is when it gets smaller because then it's harder to breathe. So it's either bronchiolitis or bronchostasis. I'm going to go with bronchostasis, which is correct. What does sepsis mean? Okay, I've heard this a lot in Grey's Anatomy, so hopefully I'll get this right. An infection caused by bacteria in the blood, a medical term for a sibling or a sleep disorder. Okay, so it's obviously answer number 1, which is an infection caused by bacteria in the blood. Question number 24. Which of the following suffixes mean to look or observe? Scopy or scopic, tomy or gram? So, like a microscope is when you look at something, so I'm going to go with scopy or scopic. Correct. Question number 25. What is ecchymosis? A contagious skin disease, a virus, or a black and blue bruise? Okay, I've never heard of this term before, but I am going to go with a bruise. Ha! Okay, number 26. Which of the following suffixes best describe a surgical operation or removal of a body part? Ectomy, stasis, or malacia? I'm pretty sure it's an ectomy because when you get your appendix out, it's called an appendectomy. So that is correct. Go Grey's Anatomy. Number 27. What does arrhythmia mean? To have an irregular heartbeat. It is a Latin word that means to arrive or to have rhythm. So I'm pretty sure it's an irregular heartbeat. Correct. Which medical term describes the inflammation of the thymappanic membrane? Labyrinthis, anotia, or myringitis? I have no idea, so I'm going to go with myringitis, and that is correct. Maybe I should have been a doctor. Number 29. What does edema mean? Ulcer, swelling, or skin rash? Or edema, sorry. What does edema mean? An ulcer, swelling, or skin rash? So, I'm going to go swelling. Correct. Which medical term describes the disease of the heart muscle? Cardiomyopathy, myopathy, or cardioplexy? So I'm pretty sure it's cardiomyopathy, which is correct. Okay, question number 31. Which medical term describes the removal of the gallbladder? A cholangiography, cholecystectomy, or a cystectomy? Okay, I literally have no idea, so I'm going to choose a cystectomy, which is incorrect. The correct answer is a colostectomy, or whatever that is. Anyway, question number 32. Which medical term describes painful menstruation? Dysmenorrhea, dyspareunia, I don't know, or anaphylaxis? Okay, literally no idea. All I know that it's cramps and it hurts really bad. Anyway, so I'm going to go with no. Okay, so I chose anaphylaxis, and that is incorrect. It is the dysmenorrhea. Question number 33. Which medical terms describes the region above the pubic bones? The perineum, the transperineal, or the suprapubic? I'm going to go with the suprapubic because it says pubic at the end, and that is correct. See, all you gotta do is like look at the word and try and figure it out. Anyway, question number 34 is, which medical term describes the enlargement of a finger or a toe? Dactylomalagy, diaphysis, or kyphosis? I'm going to go with the dactylomalagia. Sorry, I know I'm like butchering these words. Anyway, I'm going to go with that one because it says dactyl, and I'm pretty sure. Okay, so that was correct. Number 35. Which of the following terms mean upon or on top? Epi, intra, or sub? So, I'm pretty sure intra means like going into. Sub, I think, is bottom, so I'm going to go with epi, and that is correct. Question number 36. What is anaphylaxis? So I can know this before even looking at any of the options, but the options are: it means to faint, it is a hemorrhoid, or it is a life-threatening allergic reaction. And it is a life-threatening allergic reaction. That is correct. What is aphasia? Being unable to speak or understand when spoken to clearly. Swelling of the face, or it means going through a phase. So I don't think it means going through a phase. I'm pretty sure it is swelling of the face, but I could be incorrect. And yes, I am incorrect. It is being able to speak or understand when spoken to or speak clearly. 38. Which medical terms describes the disease of a lymph node? Adenopathy, lymphadenopathy, or anadectomy? I'm pretty sure it's the lymphadenopathy because it says lymph in it. Okay, correct. What does apnea mean? A good appetite, not breathing, or a pimple? So the answer is not breathing, because when you have sleep apnea, you were snoring or something, and you just stop breathing for a minute. So that is correct. Number 40. What does the suffix ieratic, IATRIC, mean? Gender of or relating to a physician, or a spasm or a contraction? A spasm or a contraction. So I am going to go with a spasm or a contraction, which is incorrect. It apparently means of or relating to a physician. Number 41. What does the prefix carp or carpo mean? Neck, blood, or wrist. So the answer is wrist, because when you have carpal tunnel, it is affects your wrist. Number 42 is, which of these prefixes is related to the kidneys? Nephro, recto, or hepato? I'm going to go with the hepato because, okay, well, apparently that's wrong. It is nephro. Okay, so number 43 is, which medical terms describe the membranes that cover the brain and spinal cord? Meninges, or meninges, myasthenia, or cerebrospinal fluid. I'm pretty sure it's the meninges, which is correct. Question number 44. What does suffix itis mean? digestion, sleep disorder, or inflammation? And I'm pretty sure the answer is inflammation, and that is correct. True or false? Hyper and hypo have the same meanings. That is false. I'm pretty sure hyper means like elevated and hypo means low. And that is true. Which of the it's false. Hyper and hypo are different. Number 46. Which of the following prefixes best describe numb or sleep? Cario, narco, or lapro? Pretty sure it's narco, because when you have narcolepsy or narcolepsy is when you just like fall asleep randomly. So I'm pretty sure it's narco. Correct. 47. RX is an abbreviation for a diagnosis, a prognosis, or a prescription, and it is a prescription. Okay guys, so apparently my video got cut off and we missed the last two questions, 48 and 49, but anyway, I got 40 out of 49 right, and it says, bravo, you passed with flying colors. Medical terminology has nothing on you. You were able to identify medical prefixes and suffixes that usually only people in the medical field recognize. With results like that, we might have to assume you're in medical school or you've studied Latin extensively, which yes, a lot of medical terms are Latin, so it helps if you know that, which I've never studied Latin, but I just know to look at different parts of the word to try and figure things out. Anyway, so if not, consider it you're a natural. These terms aren't used in everyday life, so being able to recognize them gives you an upper hand when it comes to understanding complex medical dialogue. So there's that. I hope you enjoyed this video. If you did, don't forget to like and subscribe for future videos, and I will see you next time. Bye. To do the reflexes, or sorry, cardiomyopathy, transparent,